Don't miss these 8 early signs of cancer, they could save you. Did you know that 1 in 3 people will be diagnosed with cancer in their lifetime? Yet, millions of cases are detected at late stages each year simply because people don't notice the early warning signs. The American Cancer Society emphasizes that catching cancer at stage 1 can result in survival rates exceeding 90% for many common cancers. However, that figure plummets to less than 20% when the disease progresses to stage 4. Over the next few minutes, we'll look at 8 subtle warning signs that could be critical for early detection and potentially save your life. These aren't the obvious symptoms that everyone knows about, but rather the quiet signals your body sends before things get serious. Most people ignore these signs entirely, but they could be the key to early intervention. We understand your concern that any ache or pain could be a sign of cancer, especially with the abundance of information available online. What sets this video apart, however, is that it focuses on scientifically proven warning signs rather than internet rumors. These are the same signs that have helped countless people detect cancer early, when treatment is most effective. This information isn't just another health scare, but rather a tool that gives you the opportunity to arm yourself with knowledge that can make a significant difference. We've also created 2 additional in-depth videos on this topic that you may find valuable after watching this one. Now, let's dive into the details. 1. Bone pain. One of the most overlooked signs of potential cancer is persistent bone pain. Unlike the temporary discomfort from exercise or minor injuries, bone pain associated with cancer typically worsens over time and is often worse at night. When cancer starts in or spreads to the bones, it disrupts the normal structure of bone tissue, causing a deep, piercing pain that's hard to ignore. Primary bone cancer, medically known as osteosarcoma, typically affects the long bones of the arms and legs. The pain may initially be mild, perhaps feeling like a strain or muscle ache, but gradually becomes more severe and persistent. This is especially worrisome because it can significantly impact daily activities, making simple movements increasingly difficult. Some patients describe the sensation as a throbbing or aching pain that does not respond to regular painkillers. If you are experiencing bone pain accompanied by swelling, increased tenderness, or unexplained fractures, it is vital to seek immediate medical attention. Early detection of bone cancer significantly improves treatment outcomes, and survival rates are significantly higher when detected early. 2. Eye pain. Your eyes can provide valuable information about your overall health, including potential signs of cancer. Ocular melanoma, although rare, is the most common primary form of eye cancer in adults. Symptoms often begin subtly but can progress to more noticeable changes that should not be ignored. When cancer develops in the eye, it can cause a variety of distinctive symptoms that are different from common eye problems. You may experience blurred vision that doesn't improve with new glasses, or see strange flashes of light that can't be explained by a migraine. The most worrisome sign is the development of a dark spot on the iris that gradually changes size or color. Advanced imaging techniques, such as ophthalmoscopes, allow doctors to examine the internal structures of your eye. People with light-colored eyes or fair skin are at higher risk for ocular melanoma. Don't ignore persistent eye pain or vision changes. Early intervention can save both your vision and your life. Regular eye exams are especially important if you have risk factors such as prolonged sun exposure or a family history of eye cancer. 3. Body rashes. When it comes to skin changes, some types of rashes require immediate medical attention. Leukemia, a cancer that affects blood-forming tissue, can manifest itself through characteristic skin symptoms that many people mistakenly attribute to minor conditions. The key difference is how these rashes look and behave. The tiny, round spots that appear on the skin are the result of a deficiency of platelets, a common symptom of leukemia. These spots are usually 1 to 2 millimeters in size and do not fade or disappear when pressed. The color ranges from red to purple or brown, and they often cluster together in areas where pressure is applied, such as the ankles or around tight clothing. Understanding the mechanism behind these spots is crucial. Leukemia interferes with your body's ability to produce healthy platelets, which normally help prevent bleeding. Without adequate platelets, tiny blood vessels called capillaries can leak, creating these characteristic spots. Unlike normal rashes, which may itch or fade within a few days, leukemic rashes persist and may be accompanied by other symptoms, such as unexplained bruising or bleeding. 4. Nail marks, subungual melanoma, a form of skin cancer that develops under the nails, often begins as a harmless-looking streak. Known medically as melanonychia striata, this dark line runs vertically along the nail and requires close observation. Unlike normal nail pigmentation, cancerous streaks usually appear suddenly and continue to develop. The most common location for subungual melanoma is the big toe or big toe, although it can occur on any nail. What makes it especially dangerous is how easily it can be confused with a common nail injury or a fungal infection. The main warning signs include a dark band wider than 3 mm, different colors within the band, or blurred borders. Understanding Hutchinson's sign is crucial. This refers to when dark pigmentation extends beyond the nail onto the surrounding skin. If you notice any nail changes accompanied by pain, splitting of the nail, or bleeding, do not delay in seeking medical attention. 5. Unexplained night sweats. Night sweats that soak through bedding and nightwear may be a sign of something more serious than a warm bedroom. When these episodes are recurring and not related to environmental factors or menopause, they may indicate occult lymphoma. Understanding the difference between normal sweating and abnormal night sweats is crucial. Night sweats associated with lymphoma usually occur along with other B symptoms, so named because of their significance in diagnosing cancer. These profuse sweats often accompany unexplained fever and weight loss, creating a picture that oncologists consider potentially serious. Night sweats occur because your body is working hard to fight off cancer cells. The mechanism behind cancer-related night sweats involves your immune system's response to the disease. Because lymphoma affects your lymphatic system, your body produces inflammatory chemicals that can disrupt temperature regulation. While occasional night sweats are normal, especially during illness or stress, persistent episodes that leave you soaking wet should prompt you to seek medical attention. 6. Persistent heartburn. Chronic heartburn, medically known as gastroesophageal reflux disease GERD, may seem like a simple nuisance. However, if it persists despite lifestyle changes and medications, it could be a sign of something more sinister, esophageal cancer. Esophageal cancer often first presents as persistent acid reflux that doesn't respond to conventional treatment. The link between chronic heartburn and cancer is repetitive damage to the lining of the esophagus over time. Stomach acid can cause changes in the cells lining the esophagus, leading to a condition called Barrett's esophagus. This precancerous condition significantly increases the risk of developing esophageal adenocarcinoma. Watch for warning signs like difficulty swallowing, food getting stuck, or unexplained weight loss along with heartburn. If you've been treating your heartburn with over-the-counter medications for more than 3 weeks without improvement, it's time to see a doctor. 7. Jaundice. Characterized by yellowing of the skin and eyes, jaundice occurs when bilirubin builds up in the body. While jaundice can result from a variety of conditions, its sudden onset in adults is often a sign of pancreatic or liver cancer. In pancreatic cancer, tumors can block the bile ducts, preventing bilirubin from being processed and released normally. This blockage causes bile to leak into the bloodstream, turning the skin and whites of the eyes yellow. The color change often begins subtly but becomes more pronounced as the disease progresses. The pancreas is located deep in the abdomen, so early detection of cancer can be challenging. That's why recognizing jaundice, especially if accompanied by upper abdominal pain, dark urine, or light-colored stools, is critical. 8. Fever. A persistent or recurring fever that can't be explained may be the body's way of signaling blood cancer. Unlike a typical fever that goes away within a few days, fevers associated with cancer often follow a clear pattern and may be accompanied by other systemic symptoms. Leukemia and lymphoma can cause your immune system to produce chemicals called cytokines, which leads to frequent fevers. These fevers can occur without any obvious infection and are often accompanied by other symptoms, such as night sweats or unexplained weight loss. The pattern may include temperature spikes at regular intervals, known as cyclic fever. If the fever lasts longer than 2 weeks or returns without a clear cause, it's important to see a doctor. Blood cancers can weaken your immune system, making you more susceptible to infections, as well as directly causing fevers. A thorough evaluation usually includes blood tests to look for abnormal cell counts and other signs of disease. Remember, early detection greatly improves cancer treatment outcomes. While these signs don't automatically mean you have cancer, they deserve proper medical attention. Thank you for watching this video. Please like it and share it with others who might benefit from this knowledge. Don't forget to subscribe to our channel for more informative health content. If you enjoyed this video, we're sure you'll enjoy the video on screen as well.